Thank you for joining us for this evening's webinar, where we will be looking at the anticipated impacts of Bill 15, which aims to reorganize Quebec's health and social services. Tonight's extraordinary turnout, for which I thank you again, is indicative of the widespread concern about the major shift in policy which this bill suggests. The stated purpose of the sweeping overhaul proposed under Bill 15 is to install a more effective system, facilitate access to services, enhance coordination between different components, and bring communities closer to decisions related to the organization and provision of services. However, following analysis of the 1,130 articles modifying some 30 existing foundational provincial laws, numerous healthcare advocates have concluded that Bill 15 would have the opposite effect. Leaders of the English-speaking community also suggest it could erode access to health and social services in English, and it eliminates long-standing community governance mechanisms of the institutions our community built and maintained for generations. This evening's speakers are all experts on various aspects of this bill. We will get to them in a moment, but first let me introduce tonight's moderator. Alicia Bryan Baines began her career at Global Montreal as one of the few Black reporters seen on TV news in Quebec. A lot has changed since then. After more than a decade and a half in journalism, that included a spell as Global's parliamentary bureau chief at the National Assembly, Alicia retired in January of 2020. She has since mentored young Black journalists with the Canadian Association of Black Journalists and did a short stint as communication manager of the Canadian Race Relations Foundation. Alicia currently sits on QCGN's Strategic Priorities Committee, where she has been extremely helpful, as she is tonight. She also sits on the board of the Fraser Hickson Institute, a nonprofit private library in Côte-des-Neiges that aims to promote literacy. Last year, she became the director of the Bishops' Forum, a civic leadership institute which gives young English Quebecers the opportunity to learn, share, inspire, and be inspired. In 2022, Alicia was named one of CBC Quebec's Black Changemakers, members of the Black community who give back, inspire others, and help shape the future. Welcome, Alicia.
Thank you, Eva. Thank you very much for that introduction. And thank you all for being here. We're going to introduce our panelists to you. Thankfully, it is a very, it's a very complex bill. And thankfully, we are fortunate to have our panelists here with us to answer your questions later. But first, if you don't mind, I would like to get a few questions in with them. So first off, André Fortin, the Liberal health critic André Fortin was first elected to the National Assembly of Quebec in 2014. Where he represents the electoral district of Pontiac. As health critic, he sponsored a bill to establish the presumption of consent to organ or tissue donation after death, and another to improve the quality of care through the setting of ratios in certain institutions. Fortin is also chair of the Committee on Culture and Education, as well as the official opposition critic for agriculture, fisheries, and food, forests, as well as the critic for the Outaouais and Abitibi-Témiscamingue regions. During his early years as an MNA, Fortin sat on multiple committees and was a parliamentary assistant for the Minister of Finance. In 2017, he became Minister of Transport, Sustainable Mobility, and Transport Electrification. Since 2020, he has been a member of the Subcommittee on Parliamentary Reform, a member of the Committee on the National Assembly and Official Opposition House Leader. Prior to his election to the legislature, Fortin was a director of government relations for Canadian telecommunications company TELUS. He previously served as political aide in the offices of Paul Martin, Jean Lapierre, Bill Graham, and Ralph Goodale. Thank you for being here.
Thank you for having me.
All right. Our second panelist, who we will get to right after, is Jeff Shammy. For almost 2 decades, Jeff Shammy has been the president and CEO of Cedars Cancer Foundation at the McGill University Health Center. As one of Montreal's leading fundraising professionals, Jeff has guided the transformation of Cedars into one of the city's leading foundations, recognized for its support of cancer care, research, and education. The mission of the foundation is to improve the health and well-being of pediatric, young adult, and adult cancer patients and their families throughout and beyond treatment by leading philanthropic initiatives that support excellence and innovations in clinical care, research, education, and supportive care services. Jeff is also a Westmount City Councillor, where he is the Commissioner of Hydro Westmount and Chair of the Finance and Administration Committee. Jeff, thank you also for being here. Our third panelist is Aaron Durfel, who is the Montreal Gazette's health and medical reporter, specializing in investigative and narrative journalism in more than a 30-year career that has taken him across North America. Aaron is a 3-time finalist of the National Newspaper Awards, and in 2021, he won a Canadian Association of Journalists Award for his reporting on the COVID-19 pandemic in Quebec. His 2020 investigation into the horrific living conditions at the Residence Herron nursing home earned the grand prize of the Prix Judith Jasmin, Quebec's highest journalism accolade. A graduate of the journalism program at Concordia, Mr. Durfel has taught at the university since 2001, focusing on access to information requests, court records, and financial reporting, among other subjects. His nonfiction narrative, A Response to the 2006 Dawson College mass shooting, was selected for the book, The Bigger Picture, Elements of Feature Writing. His reporting has included multiple stories about Bill 15 and specifically its impacts on the English-speaking Quebecers. Thanks for joining us, Aaron. And last but not least, we have Eric Maldoff. A longtime community activist, lawyer Eric Maldoff was the founding president of Alliance Quebec and a former chair of QCGN's Health and Social Services Committee, which successfully negotiated changes to provincial policy legislation and regulations, enabling greater access to health and social services for English-speaking Quebecers in their own language. He's been on the board of directors since 2017. Eric has served as chair of the executive committee and vice chair of the board of directors of the McGill University Health Center, and was chair and director of the Montreal Children's Hospital. Eric has also served as a member of the board of governors and executive committee of McGill University, and is a governor emerite of McGill University, McGill was the vice chair of the interim governing council for the creation of the Canadian Institutes for Health Research and founding chair of Canada Health Infobank. He is also a past chair of the board of the Old Brewery Mission. A member of the Order of Canada, Eric has been honored for his multiple contributions to Quebec's English-speaking community with QCGN's Sheila and Victor Goldblum Award. Thank you all. Thank you for being here. So we will start with you, Mr. Fortin. What exactly is in this bill? For those who are sort of maybe just coming at it for the first time, what's in this proposed law that people should be aware of?
Well, thanks for inviting me tonight, and thanks for giving me this opportunity. I'll try to be brief in my answers. Obviously, as you said it, this is a bill that has 1,200 articles. It's the second largest bill in the history of the province of Quebec, the largest one being the Civil Code. So this is quite an extensive bill. The basic principle of it is to say that instead of having regional entities such as the CIUS West Island, the CIUS Centre-Ouest, the CIUS de l'Est de Montréal, the CIS Outaouais in my region and others, there basically is one healthcare entity that oversees everything. So there is no more regional independence, so to speak. It merges everything into one. And the administrators, as we know them, the board administrators that are present at the West Island CIUS or in my region, they essentially become, instead of volunteers, they become paid representatives with instead of having a direction and administration function, they become more of a verification and audit. That's really their reason for being. So we're basically saying, what the government's saying is, we will have a vision and we will bring it forward all the way down to those who deliver direct services to patients. What the health minister keeps repeating over and over again to justify his bill is to say, well, during the pandemic, it was hard. Different establishments weren't talking to themselves. And we realized at that point that we need one integrated entire system across the province so that people work better together. Our premise for our action during this bill is to say, sure, people can work better together, but you don't need to make these wholesale changes in order to do that. There's a way to do it without bringing together these entire reforms, which, as you've said, have led to the nurses, the various healthcare employees, doctors saying this will demobilize the healthcare workers, which to us is exactly the last thing we need to do. So really, if I was to look at it in one sentence, it's basically an over-centralization of the healthcare system so that Quebec City can give one directive and then everybody has to follow it, which obviously leads to a loss of on-the-ground innovation.
And so you mentioned on the ground. What are some of your concerns and what will that mean for the community?
Well, the biggest thing in healthcare in general is attracting people to the profession, making them more of a part of the healthcare system, giving them more local decision-making abilities, finding ways of making healthcare professions more attractive. So the real worry here is that if there is a demobilization, for example, there are within every hospital, there are what is called the Comité des médecins, dentistes, pharmaciens. They are people who choose to get involved, people who act sometimes as a counterpower, as a counterbalance to government initiatives. We saw this, for example, at the Lachine Hospital over the last year. There was a lot of talk about closing down the emergency at Lachine Hospital, and who raised their hand to say, hold on, this isn't what our patients need. It was the Conseil des médecins, dentistes, pharmaciens of the hospital. They're the ones that we heard. They're the ones who pushed back on government ideas. So by abolishing the powers that some of these instances have and putting everything in the hands of Santé Québec, the new entity, the new agency, and their regional heads, there really is a loss of that counterpower, which when you lose these, you lose the ability for communities, whether it's yours, whether it's mine in my region, to really have a voice and to really say, hold on, what works somewhere else may not work here in my region. And I've got a solution that's a bit different that we have been making work and that we would like to keep or to work on further.
And for those who've maybe been following but might not sort of know where this process is, what stage is it at? Is it too late? What should people be aware of as to where this process is right now?
So the beauty of having a bill that's this bill and that's this big and that touches so many different aspects of, and we've touched on a few, but it touches so many different aspects of the healthcare system, is that it takes a while to study it. We started studying clause by clause, so every one of the 1,200 articles and every one of the hundreds and hundreds of amendments that the government has brought in over the last few months in, I would say, August. So it's been 4 months of study. It's been close to 200 hours, which is, and we're about, I would say, just about halfway done this bill. There's still a lot of things in there that we really haven't studied yet. So the composition of who will sit on these new regional boards, who obviously his powers have been stripped somewhat. We have yet to deal with parts of the bill that deal with unions. So one of the things we haven't mentioned is the government's taking what are 34 union affiliations and bringing it down to 3. And you can argue for or against that, but what will happen, and what is one of our main concerns that I would like people to understand tonight, is by doing that, what they will be doing is saying, for example, a nurse whose ancienneté, so her seniority is recognized at her employer right now, which may be, I don't know, this just Centre West, will have her seniority recognized everywhere she goes across the province. So the government bills this as a good thing. And it may just be in order that she may, if her family moves, be able to move without losing her seniority. But what may happen also is that a lot of the employees who work on the island of Montreal, who do not have the means of buying a house or renting a condo in Montreal, end up living, as many people do, in the suburbs. If you allow for them to have their seniority recognized in Blainville, well, maybe they will just go to the local hospital there instead of getting in traffic every day. And really, there have been no studies on what the impact of such measures will be. So those are still elements that have to be discussed. So there's still a lot of room for improvement on this bill. There's still a lot of room for community pushback, and there's still a lot of room for amendments on this bill at this point.
So you say there's a lot of room for this, but what is the likelihood that the government invokes closure?
Oh, it absolutely will happen if this bill is not adopted by Christmas. The health minister has said, I want this adopted by Christmas so that I can start implementing it, because I want Santé Québec, this new health agency, to be in place by next summer. The problem with that is that we have a whole bunch of examples right now across the world where they moved to over-centralization, and now they're starting to look at their systems again. So if we adopt this too quickly, if we don't take the time to study every single aspect of it, if there are no amendments being put forward on parts of the bill, we'll end up with a very imperfect bill, and a very, which will still have significant impact on the healthcare system. So Alberta introduced a bill like this 15 years ago to create Alberta Health Services, which is very much like Santé Québec. In fact, the health minister and his team studied the Alberta model and replicated it through Bill 15. Today, 15 years later, Alberta announced that they are blowing up Alberta Health Services. They're decentralizing it. They're bringing it back to different entities with different priorities and operations. So you may have one entity for home care, you may have one entity for surgeries, you may have one for hospital care, but they've realized that this over-centralized model has gone too far. It hasn't given the results necessary, and they're now pulling back on it. So if we don't study it properly, if we do invoke closure at the end of the day, that's one of the things that may happen, is we'll have a very, very imperfect system. And at some point down the road, somebody will go, okay, this didn't work, let's go back to the drawing board.
And you say, you know, that might happen. The government says that, you know, reform is needed, and this is needed. Are there aspects of the bill that will work, or or you want the whole thing sort of pushed aside? Sort of explain the nuances there for those who say, again, it's a very large bill.
Yeah, there are aspects of the bill which may have a positive impact. The government wants to, and this is one of the things that the CAQ government has, or this health minister has done, is to say he wants to better understand the data behind what is happening in the healthcare system. So he's proposing to have a national users commissaire to really, or committees to really understand what is going on with users' complaints across the network. If there are common issues to different regions that we can look at and try to improve. In the same way, they've put a national complaints commissioner so that people have an appeal mechanism, and somebody looks at the types of complaints that are coming from across the healthcare system. So there may be some useful parts of the bill, but the negative parts outweigh the positives by a ton. And to us, the very essence of the bill, which is to centralize and to say we will control just about everything, it is the one part that is unforgivable in this bill. It basically says to everybody who has been running local healthcare networks over the years that we can do better than you, that we know better, that the decisions that we make will have to be the ones who are implemented. And that is in some form a lack of respect and a lack of recognition of the work that has been done and that continues to be done by people who are involved for the right reasons.
A final question. So how do you plan on making sure that the concerns that you've raised here with us are addressed? And what do you suggest sort of that the public do in between now and the time that the government invokes closure?
So there are parts of the bill which we've managed to improve through whether they are discussions with government on our part in committee or community discussions with government. For example, they have now decided to delegate some of the parts that were initially in the hands of Santé Québec. So everything to do with research in our institutions, everything to do with enseignement functions in our institutions. Initially, they'd appropriated that at Santé Québec. Now they've decided to delegate it back to the CIUS and the CIS and CIUS organizations. But again, realizing that they control the CIS and CIUS organizations at that point. So you can make some steps forward through the parliamentary committee, but really I do think that some of the people who have been getting involved voluntarily on the Conseil d'Administrations over the years, it would be to us helpful and to anybody who wants to make changes to this bill helpful if more of them would publicly say, listen, we understand you have a very maybe noble idea that you think this will improve the healthcare system, but our experience is different. And we as volunteers have brought so much to our community over the years through our implication that losing that would be would go further than what's presented here. So I think there needs to be a number of different voices. There's been people who've raised concerns. We saw the 6 premiers a couple of weeks ago raise their hand and say there are parts of this bill that are very, very concerning, but those voices at this point are probably too few and far between to have the minister really say, listen, there's a popular movement here that I need to respond to.
All right, thank you for that, and thank you for clarifying all that. And up next, we will speak with Jeff Chevy. If you could please stay around, Mr. Fortin, because there's tons of people who have questions for you at the end of this. Wonderful. Mr. Chevy, hi.
Hello.
Hello. Thank you for being here. You heard all that the minister had to say. So from your perspective, as the president and CEO of the Cedars Cancer Foundation, how does the Cedars Cancer Foundation right now currently work with the MUHC?
Well, I think, Alicia, you raise a good point, and I just want to shout out to Mr. Fortin and our elected representatives who have been studying clause by clause, because I think that we have to, for the community, for us in philanthropy, and you'll hear from Aaron and Eric shortly on who really understand, who look at the whole picture. But for us in philanthropy, the community is tantamount to being closest to the people that we care for, the doctors, the nurses, the investigators, the researchers, but the volunteers in the community that Mr. Fortin we're talking about are so vital to our history, the legacy of how we've delivered healthcare over our past, and our folks that are involved in these hospital foundations, in the hospital boards, as volunteers in the community, have been living day in, day out the issues. And now to do a huge change of what, as Mr. Fortin explained, of what Bill 15 will do in the delivery of care and have it all centralized is transformative. Yes, there might be some areas that might be improved, but we must remember the community, those that we serve, is so important. And for us at the QCGN, for our in philanthropy, for those who raise vital funds to help to take us from the standard of care to the gold standard. And what the gold standard is in philanthropy is helping the researchers, the doctors, the nurses, the caregivers with that extra value of what philanthropy can do. And now there's no doubt that representatives of the Quebec Healthcare Foundations have been in direct contact, as Mr. Fortin was saying, with government officials over the past few months. They've shown an openness to some amendments in Bill 15 to deal with foundation issues in a satisfactory manner. That's important, and we need to see those changes. But at the essence of it, the loss of local board of directors, the loss of separate legal status for our hospitals to be absorbed, as Mr. Fortin said, and you'll hear shortly from Aaron and from Eric, this is not good. This is not good for our community to be as close as we can to those that we serve. And for us at the Cedars, our cancer foundation, we work with the priorities of the hospital. So the hospital sets the cancer priorities, and our lay board will work, our grants committee will work with the hospital with their priorities, and we'll fundraise, and we'll make sure that the philanthropy in research, in cancer care or cancer education is aligned with the direct needs and the priorities. But to do a major change like this, and we see it in today, I can't believe Mr. Fortin just mentioned Alberta, 15 years later, bam, it was on the front page. This is transformative. We must look back to the legacy of how we've served our folks that we care for and help. And we need to, yes, improve, but we can't turn our backs on the past, and we need to take those lessons learned.
And so you are convinced that, Bill 15, if it passes as is, would take that away, would not give you the ability to work in the way that you have previously and serve the community that way.
As a community leader, we're very concerned with the loss of the local board of directors, the loss of separate legal status for our hospitals. But as I mentioned, on the philanthropy side, there has been some improvement, and hopefully proof will be in the pudding. We need to see that the fiduciary responsibility in philanthropy is protected, the integrity is protected, and we need to work together in the delivery of care. Hospitals and volunteers and the specialists and the experts. I mean, as Mr. Fortin said, and I think, Aaron, you wrote a great piece on this, they want to put they want to remunerate all these experts and get away from volunteers that have been closest to the patient committees, those that we care for, those that know how these hospital boards work, and they've been involved with a lot of time and blood, sweat, and tears to make it better. And just to say, oh, it's all in one place, we need to think about that really carefully. We need to really think about it.
I'll ask you the same question that I asked the minister. What are you and your organization doing from now until the possibility that the government invokes closure to sort of push forward what you've shared with us here today?
Listen, advocacy is so important. The fact people can write, call their M&A, call in, read the articles, listen to the experts, take charge, get engaged, get involved. This is the way we deliver care in health. In our health system. This is a big change. Like the minister, it sounds honey and lots of, it's very rosy with at 30,000 pieds, at 30,000 feet, but we need to make it work. And you're going to hear, you heard from Mr. Fortin, who's been, and his committee and the elected representatives going clause by clause, looking at it. 200 hours, that's a lot. They've really looked at a lot of issues and how to improve it, make it better. But at the end of the day, we need to advocate. We need to raise our voices. We need to stand up for our patients, for philanthropy, for local boards, for getting involved and making a difference.
Thank you for that.
Thank you.
Thank you. All right. And up next, we'll have Aaron Durfell, who's the Gazette Health reporter. I'm curious, Mr. Durfell, what stands out to you in particular? You've written a lot about Bill 15, but what stands out to you in particular about Bill 15?
Okay, pleasure to be here tonight, Alicia. Well, I just want to convey to your listeners that the Montreal Gazette takes this bill very seriously. In addition to the other pieces of legislation that the current government, the Coalition Avenir Quebec government, has been pushing forward. It's a priority for us at the Gazette under our visionary new editor-in-chief, Marlene Alucci. And so we're pressing ahead. What strikes me about this bill is the degree of centralization and the founding of this Crown Corporation Santé Quebec. This is something that I haven't seen before, and I've been covering health for 25 years. This is the third major reform that I've covered. Andrea Fortin was talking about Alberta Health Services. The Premier there, Danielle Smith, today announced that she's dismantling Alberta Health Services. That got me to thinking about to the mid-1990s. You'll recall that the former Premier at the time, Lucien Bouchard, he proceeded with a reform, the virage ambulatoire. He closed some hospitals in Montreal, including the Queen Elizabeth. He bought out nurses, only to hire back some of these same nurses a few years later. So obviously, the experience in Alberta raises the question: are we going to go down the same path that Alberta has gone through, this tumult and turmoil of restructuring, only to in 6, 7, 8, 9 years have to decentralize? This bill doesn't address some fundamental problems in the system when we're talking about overcrowded emergency rooms, shortage of staff, long wait times. The thinking is that somehow, under Christian Dubé's vision, this idea of creating this crown corporation, Santé Quebec, that he would somehow hire the top guns, the so-called top guns in the private sector, and they would be possessed of this wisdom to run things just so much more efficiently. Again, as someone who's been covering healthcare for the past 25 years, I have doubts, and it's my role to continue to scrutinize this bill, and when it's adopted, to report on its the aftershocks of it, if you will. One of the things I will be writing about is the experience in Alberta, and I'm currently working on a follow-up. I'd spoken to Andre last week, and something that hasn't been mentioned is the voice of the patients. That I spoke with Paul Brunet, who's the Director General of the Conseil pour la protection des malades, and he says, they're fighting to keep what they used to have, and they under this bill, they were able to regain some of what they used to have, but it's just, to me, shocking that they have to fight to keep their voice, the voice of the patients.
So can you explain, you mentioned the patients, what exactly do patients gain or lose with this bill? If you could be,
I've been studying it, I'm reading it. To me, it's very structural, it's very bureaucratic, it's overly bureaucratic. I think it says something when the health minister himself, independent of Bill 15, he announced these access coordinators. That to me is, I think, in my opinion, a fantastic idea. It has nothing to do with Bill 15. The idea of an access coordinator is to cut wait times. Well, that makes sense. He's talked about closing the loophole to allow these private agencies to charge exorbitant rates, to place nurses in various hospitals. Again, that's outside of Bill 15. So, what Bill 15 will do is create two parallel bureaucracies. You have the Ministère de la Santé et des Services Sociaux that will still exist, and then at a cost of $60 million over 2 years, they're going to set up Santé Quebec. What is the ulterior motive of the CAQ government? Is it for François Legault to say that he founded Santé Quebec? Similar to Hydro-Quebec? I just don't know. It just baffles me. But let's be clear, just one point. Santé Quebec, although it would be a crown corporation, it would not charge patients directly for services. It would be under Medicare, but it just has the optic of Santé Quebec.
Okay, thank you for that. You mentioned earlier Lucien Bouchard, and former Premier of Quebec, and most recently the letter from former premiers asking the government to think about this and backtrack. What do you make of that whole situation? It sort of kind of devolved into conspiracy theories about why they were coming forward, but what do you make of a force like that of 6 former premiers or several former premiers speaking out about this bill?
I can't recall a precedent for this. 6 former premiers. These were, from diametrically opposed political parties, right? The Parti Québécois seeking sovereignty, and the Liberals, Federalists, uniting in their concerns about the potential impact of this bill. And yet, in the days after that letter was made public, the media landscape was filled with speculation about possible or ulterior motives on their part, that they were trying to help out, friends in high places. I just thought that was absurd, because there were just so many different premiers, and I thought that it was a missed opportunity to really study the depth of this bill. But I think the problem is that some of the journalists who covered it, they're political reporters, they're not health reporters, so they're always thinking of a possible ulterior motive or a political angle. Look, I just mentioned that among those who first raised concerns were patient rights groups. These are not high and mighty individuals with deep pockets. They're volunteers who care about the health and welfare of patients. Often they themselves have illnesses, and they're pushing for socio-culturally safe medicine.
Thank you for that, and thank you for your input. Please, again, also stick around, because there are some questions already coming in, and there's going to be questions for you as well. Next we'll have Eric Maldoff. Hi. So you've heard what everyone else had to say about this, and sort of the concerns. What do you feel are the parts of the bill that the public should be made aware of? And if you just, right now you're on mute, sir. Yeah.
Okay.
Thank you.
Am I unmuted now?
You're unmuted. Thanks, sir.
Okay. Look, this bill, sum total, is the eviction of the public and the community from the health and social service system. Pure and simple. We will see there will be no place for meaningful participation of the community in the development of their health services going forward. Structure of the bill, just very quickly, people should understand what's happening. The government is creating what Aaron has referred to as a crown corporation. It's created by virtue of this law. Then they're taking all the institutions in the province, and they are amalgamating them into Santé Quebec. Forgive me for being a bit of a lawyer on this. When you amalgamate a corporate entity, an institution, into another one, that corporate entity ceases to exist. The law says so. It goes so far as saying all their assets become the property of Santé Quebec. It's very important, because Andre Moreau said, at some point people realize they'll go too far and they'll have to come back. Aaron says, Bouchard went too far and they have to come back on the nurses. I want to be very clear. The Institut de Cardiologie, which has an international reputation, will become, according to the words in this act, an administrative unit of Santé Quebec. And then, just so you don't get alarmed, from then on, they say you can call it an institution, but it is nothing more than a branch, a division, call it whatever you like, the shoe department of Santé Quebec. The MUHC, we took 5 major teaching hospitals of McGill University. They voluntarily brought themselves together to form the McGill University Health Center. That was the Vic, the General, the Children's, the Neuro, etc., the chest, and put them all together to provide a continuum of care, to provide the excellence of care, critical mass, and share resources. That institution will cease to exist as a legal entity. It becomes an unincorporated administrative unit of Santé Quebec. And I could mention Saint-Justin Hospital, and there are others that can be mentioned. There's no putting that toothpaste back in the tube. Once you cease to exist and all your assets and all your property have been taken by the government, That's the end of it. And I can't see how the government's going to come back and reincorporate these entities and put all the toothpaste back in that tube. And I don't think anybody can see that. And that's what is so terribly alarming about this. The fact of the matter is, the best performing institutions in our province are the ones that were built by the community, supported by the community in every possible way, through volunteer hours, volunteer service on boards of directors, participation in fundraising, participation in foundations, raising money for those institutions. And you look at them, they flourish. And they were created before Quebec even had a Health and Social Services Act. It was created by the community to serve community needs, and they've been very effective. There are institutions that have been created since Barrett's Bill 10 that have languished. Some of the centre integrated health centers in the regions have not performed all that well. But you don't throw the baby out with the bathwater. If there's some problems in some regions, go fix them. But the idea of evicting the community, what should be happening right now is where the community is insufficiently engaged, the government should be putting in real effort to get them engaged, to give them the skills to understand how to be on boards of directors and to do all those things to enable them to have the capacity to play a determinative role. All the scientific research, I challenge you, go look up community engagement outcomes in healthcare. And what you will see on the internet, starting with the World Health Organization, is the better the community engagement, the better the outcomes, because you get a feedback loop that works. Well, that's critical here. So we're going to take all our institutions, they're going to become administrative units. The administrative units, Santé Quebec, the board of 13, what do they call them? Top guns from Quebec Inc., obviously all deeply involved in healthcare and knowledgeable of it. They will be running the system with a CEO, all appointed by the government of Quebec. And then these administrative units down on the ground, well, they'll be there with the current CEOs of those institutions are demoted into executive directors. Okay, directeur général. And those people will be under, and to use the words in the act, under the direct authority of the CEO of Santé Quebec. What does that mean in terms, and then those administrative units are entitled to have institution councils. Institution councils will be advisory in nature.
Right.
They can tell the president, the executive director what they think, who then has to ask permission of Santé Quebec and go up the ladder and down the ladder. That's the system we're into.
Yeah, so that sounds like a lot, and there are a lot of people with questions about that. So thank you very much for your time and your input, Mr. Maldoff. We're opening it now to the questions, and thank you. We're going to try to get to as many of them as possible. The first question we have is from Mr. Fulton.
There's one point. I apologize if you think I took too much time. People
No, not at all.
Get involved. One thing you should know, the government has refused to allow any local negotiation of working conditions. So for communities that are not part of the cookie cutter population of Quebec, where there's diversity, there will be an inability of the institution to negotiate arrangements that are able to serve the local community as it is found with all its diversity. And that takes skill and effort. So you see our institutions in Montreal doing that, and it's fine to have cookie cutters in the regions, but in Montreal, that won't fly. And the minister has been adamant, we're going to have one employer and collective agreements across the province. And he was asked about local negotiation, not on. And finally, this government has refused to engage in meaningful discussion of what it's trying to really achieve, and refuses to sit down and have discussions with people who have legitimate concerns. And that's unheard of.
Thank you for that. Thank you again for that. And everyone who's been waiting for your questions, we are going to get to them. All of our panelists, as you can see, are still here. So we'll get to them, and we'll start with Mr. Fortin. So are there any, this question comes from one of the people joining us here tonight. Are any patient liberty rights compromised with Bill 15? What right does the minister have to push the bill to make it happen versus people? So yes, I guess the question is, so are there any patients' rights and liberties that are compromised with Bill 15?
That's really not the spirit of Bill 15. It doesn't abolish any of the mechanisms by which people can make their voices heard. Now, it does somewhat lessen the voice of users around the conseil d'administration. So there are quite a few users who sit around the conseil d'administration of their local healthcare establishments. So there will be less of those. Absolutely, the minister has chosen to reorganize those and put different people on on those boards. But the mechanisms by which people can formulate a complaint and put it in, that really hasn't changed. What will, however, change is that because the local boards no longer have the local volunteer boards no longer have any say whatsoever into the type of care that is given, the direction in which it wants to go, the priorities that it sets, then absolutely patient care will be compromised in some areas. If you don't have that local ability to really tailor the programs to your local needs, you're not offering the patients the quality level of care that they need. You're just offering, as Eric said, the cookie cutter solution that is being set forward by Quebec City. And that's where the minister really fails, and he says it in these words: we come up with solutions, some establishments put them in, some establishments don't. We really have no control over it. We want to make sure everybody puts in what our best practices are. But that's where he fails to understand that best practices in Trois-Rivières may not be the best practice at the Suisse West Islands.
Thank you. Sarah from Montreal has a question saying, what is the anticipated impact of Bill 15 on the designated status under the Charter of the French language that allows our institutions to function bilingually and ensures access to services in English?
So that's not an issue that has been discussed yet, meaning there are articles in the bill that say that basically carry over the provisions that are already in the law on health and social services. But it's not provisions that we've yet to delve into. It's still in that half of the bill that hasn't been studied. But there really doesn't seem to be, at first glance anyway, it doesn't seem to be the idea or the orientation of the bill is to change that in any way, shape, or form. But when you're taking away local voices, what you're taking away is counterpowers who will say, hey, hold on, why are we not giving the proper services in the proper language to people right now? Hey, why are we getting more complaints based on language in our institution? You no longer have that voice coming up saying, we're hearing what the problems are. You're just hearing the Quebec City voice saying, fix this, fix that, fix this. But doesn't allow for as quick a reaction time from the local institutions as you would. So does the law change anything in that regard? No. Will it have an impact on the way people get services in their language? Probably.
No, the answer is yes. It does have an impact directly, if you don't mind. For those who want to look at the article, look at Article 348. The right to services in English is in the in the English language is in the Health and Social Services Act, and it's available to all English-speaking persons. That's what it says, and that's been retained. What it changed is it says that right to service is as the services are outlined in access programs for English language services that have to be developed across the province. What's changed is they used to be, up to now, they're prepared locally. The access programs now are prepared centrally. There's going to be one access program for the whole province. Number two, the access programs had to have provisions in there, not only what services are available, but what's your manpower arrangement to ensure that those services are available. That's been removed. What's also been in the law up to now is that institutions that are recognized as bilingual under the Charter of the French language, and the word was designated, so it's somebody who knows the law who asked that question, are designated under 508 of the Health and Social Services Act to provide all of their services in the English language. That's been deleted from the access program section also. So those deletions actually diminish the rights and access to services. They will not indirectly do it, they will do it directly.
So thank you.
Alicia, if I can add, this is an important issue here. What we're talking about is the potential erosion of minority language rights in Quebec in the healthcare sector. And in the Quebec context, we're talking about English language. For many patients who are bilingual, as they reach that point in their lives and they suffer from cancer or dementia, they want to be cared for in their mother tongue, which would be English. So even prior to the tabling of Bill 15, a number of hospitals across the province had expressed concern that the Legault government was showing great insensitivity on this question of access to healthcare services in English in Quebec. There are a number of hospitals that wanted bilingual signage, and that wasn't being respected. Eric Miles is absolutely right when he's talking about these access plans that all these various CISs and CSs, they have an Anglophone representative on their board to ensure the drafting and maintenance of access plans, and that all gets centralized under Bill 15 and Santé Quebec. And the Community Health and Social Services Network has raised very serious concerns about that. So going forward, there's a genuine fear that there will be more erosion of access to healthcare services in English, and arguably this is more important when you think about it, people's lives, their illness, than what we've heard about in terms of Bill 96.
I'm going to add one other point.
And yes, I will let you in 2 seconds. I just want to let those the people there that we're going to extend the time a little bit, because as you can see, there's a lot of questions and answers that you want to hear about Bill 15. So Eric, yes, go ahead, and you can still continue to put your questions through, and we're going to extend the time by another 15 minutes or so to allow for more questions to be heard.
One of the other things that happened, there are a number of institutions that are identified in the bill as grouped institutions. They happen to be, for the most part, institutions that were built by the English-speaking community. Jeffrey Hale, the Douglas Hospital, Grace Dart, St. Mary's, the Jewish General Hospital, Miriam, Mount Sinai, Maimonides, Lethbridge, Leighton Mackay, to name a few, Résidence La Chute. They're listed as being bilingual hospitals. Those institutions up to now had a veto over any decision of their board of directors to apply to the office to have their bilingual status withdrawn. Under Bill 101, bilingual status cannot be withdrawn in the health sector unless the institution asks for it. And that's an amendment the community fought for in Bill 101 under Mr. Levesque and got it. So we protected our ability, because what institution is going to vote, have its board say, abandon it? Well, Santé Quebec is now the board of all those institutions. So when I mentioned this to an assistant deputy minister, that they were taking away the right, he looked at me with a smile on his face and said, well, the office has final word on this, and he would never take away a bilingual status. Well, how many of your listeners do a vote right now whether you believe that?
Thank you for that, for adding that aspect of it. And there's a few questions sort of as it pertains to sort of philanthropy and raising money and the independence of some of the institutions. So this question is for Jeff, actually, and then Eric also. So regarding philanthropy, so when money is raised for a certain purpose, for example, the purchase of a piece of equipment or the construction of a certain facility or the financing of a particular research project, will the foundation, which has solicited these contributions, be able to insist that the receiving entity, which will now be Santé Quebec, instead of the community institution, actually use the funds for the purpose of the intended donors? That's the
Well,
question.
Alicia, you raise an excellent, or the questioner raises an excellent question. The funds have to be used for a specific purpose. They must, we have a fiduciary responsibility to do that. We believe that Santé Quebec, when they come together, they'll make those changes and they won't transcend those powers. We really believe those amendments and suggestions and recommendations that foundations have asked the government to look at with good faith have been listened to. But again, proof will be in the pudding, and I'll go over to Eric to see what his thoughts are. But hopefully that will continue the way it has been from the beginning to now and for the future, that when fundraising, when funds are raised for a particular purpose, they must be designated for that. It can't be just usurped. Eric?
The principles you're enunciating are correct. The government has become sensitized to the fact that there is a risk of losing substantial funding that is taking place through fundraising by our foundations right across the province, especially for the major institutions. They've been bending over backwards, trying to come up with amendments that reassure 6 ways from Sunday that money that a donor gives for a specific purpose will be used for that purpose. So there's no doubt the government wants to try to say for sure that's what's going to happen. But it's a highly centralized system, and how it plays out in the fullness of time remains to be seen. But certainly the signal that they're trying to give in the legislation is if a donor gives money, it's going to be used for that purpose.
Thank you. This question is sort of across the board, and any one of you could sort of jump in, Mr. Fortin, if you could start, and sort of we'll go around. The person asks, how does the proposed Bill 15 centralization resolve or address the health system difficulties caused by a lack of budget or hiring of staff?
It does not. There is nothing in this bill that talks about how healthcare will actually be improved or how funding is delivered. All it does is it's a governance structure reform. All of those items which Aaron talked about earlier that can possibly lead to improvements and which the minister talks about publicly are made outside of Bill 15. They're really, if you look at the bill and you go through all of the 1,200 clauses, there is nothing in there that you could really sink your teeth in and say, this measure here will have an actual impact on the delivery of healthcare. They've put in a few things here and there and a few amendments, enough to give themselves speaking points to say that it will. For example, the obligation to find an alternate solution if your health establishment can't give the services quick enough. But those things are already in the L4S. They're already in the healthcare law as it stands. So there really aren't any major changes to say, we will improve healthcare by doing this or that. What it is, it's a restructuring, it's a governance issue, and it's a big shiny object while healthcare isn't getting any better across the province.
Thank you. Anyone else on that aspect of it? I mean, it's pretty clear. Or are there any aspects of the bill that you don't want to throw out with this that could benefit the public? And any of our guests? No.
My judgment, this bill was made by bureaucrats for bureaucrats, and it'll make their jobs a lot easier. They can show up at the office at 10, give their orders by 11, and go to sleep by noon and expect everybody to implement their decision. I'm sorry, that's the way the bill reads. And it's really a deep concern, because when everything goes from the top down that way, health is about people on the ground needing help. And this is backwards, absolutely backwards. And the minister will not engage in a discussion of this. And he's threatening closure. He's going to ram it through. And as I say, once it's done, it's done.
So you've all spoken very passionately about this, and so one of the questions that people are asking here in the chat is, what should they be doing? So what aspects, where should they be going? What should they be doing to engage as this bill continues making its way through? And I'll start with you, Mr. Fortin, if you could.
Yeah, I think some of the panelists mentioned this earlier, but proactive writing about your concerns, getting people in the healthcare system involved as well. If you know people in the healthcare system, getting them to realize what's in this bill, the more healthcare workers know what's in the bill, the more they speak up against it, the more they realize that it is a demotivating factor for them. And to me, that's the one piece that we cannot, any government cannot simply shove aside and say, I'm going to ignore this. If you have healthcare professionals out there saying, this will demobilize, this will lessen attraction of healthcare workers to our public sector in Quebec, that's the biggest fight we have, is attracting healthcare workers. So if the end result is that we're demotivating them, that's a big incentive for government to relook at all its programs, because there has to be that voice that is heard by government, whether it's the healthcare workers, whether it's people who got involved, but there has to be a voice that's heard from government on this. And it can come from a few premiers who make a historical plea. It can come from opposition. It can come from voices like Eric's and people around the call today, but it has to be larger scale.
Anyone else? Anybody want to add to that?
Well, I'm no good at the internet, but I would say somebody who is good at the internet, there are massive ways of showing massive objection or massive support for things. And the reason I agreed to participate in this is people have to understand what's happening. And I'm hoping that if they understand, they will get to their keyboards and start to send messages, set up petitions, all those things that I throw in the garbage, we should actually be doing right now. Big time.
If there's something that I can raise is the perennial debate in Quebec, Montreal versus the regions. And under this bill, it's interesting that Dr. Lucio Patroni, who was a deputy health minister prior to her appointment as the head of the McGill University Health Center, she told me she was worried that 25% of the staff at the MUHC work off the island of Montreal. And she was worried that under the bill, workers could keep their union seniority. They could go, Andre, you mentioned that too. They could go, work off island. This would have a potentially disastrous impact on the MUHC, which is Quebec's largest hospital network. And then there are, other institutions. So already there are, again, prior to the tabling of Bill 15, there were deep concerns about the allocation of physician resources. There's this bureaucratic policy in Quebec known as the PREM, and where doctors start their careers, how this is allocated, and that this system has long favored the regions. It was put in place to help the regions initially, but now it's Montreal doctors are saying it's hurting, really hurting Montreal. So the big concern, another big concern, is that Montreal's healthcare system will continue to crumble in the wake of the adoption of Bill 15 in the coming years. And so, I just see my role as a journalist is to write about this. So I just see that I see myself having to chronicle what could be a disaster in the making for years to come, on top of an already weak healthcare system that had been pummeled by the pandemic. It's just, it boggles the mind.
Thank you. You mentioned Montreal. I just want to, but there are questions coming in asking how this will affect the regions and access to care in English for those in the regions. If anyone can speak to that. I mean, someone spoke generally about it, but there's some concern here about the regions where access is already sometimes spotty.
But the access committees that Eric mentioned are really the voice of English-speaking Quebecers in the region, and the way that we organize healthcare for English-speaking communities across Quebec. And if you don't have that regional voice, if it does become centralized by the bill, that's an even greater issue in the regions than it is anywhere else, because they need that advocacy voice, because the numbers just aren't there for them to make the plea and the case and to be actively listened to by government. So those access committees are definitely the sticking points for English care in the regions. But to the point, and I think it's important to make it, to the point about Montreal, we cannot underestimate the potential impact of this on how many nurses, technicians, orderlies could potentially leave, whether it's MUHC, whether it's Maisonneuve Rosemont, whether it's any of our healthcare establishments in Montreal, because most of their workers come from off island. Most of them do. And if you give them the opportunity to work closer to home, it might be great for the hospital in Châteauguay, but it will drain, or actually, let's put it this way, it has the potential to really drain the resources in our Montreal hospital, and government has not justified that with any studies whatsoever, any projections. And that's something that really is a big, massive red flag for our Montreal institutions.
Andre, if I can say this, and I'm hoping I can help motivate people to get out of their chairs and do something. On the point you just made, had a conversation with one of the very top senior bureaucrats in the Ministry of Health about this bill. And that issue was raised, we raised that issue. And you know what the answer was? Oh no, you don't have to worry about that. People will go to the best administered institutions in preference to proximity.
Mhm.
And I mean, what kind of world are we living in when you hear something like that? You can spend 3 hours trying to get across the bridge and go to a wonderfully managed place by Santé Quebec, or go to 10 minutes from home and go to another wonderfully managed place by Santé Quebec, because according to the minister, they're all going to be wonderfully managed out of Quebec City.
Right. So there's a lot here, and I have to thank everyone for putting in all your questions, and thank you to all the panelists, Mr. Fortin, Mr. Maldoff, Mr. Durfel, and Mr. Chamy. Thank you for being here. I want to pass everything over before we go back to the president of QCGN, Eva Ludvig, to wrap us up here and tell us a little bit about the next steps. So
Can I say one thing that and I know I've been taking up too much space. I thought a lot about this, and the word Kafkaesque came to my mind, and I wanted to make sure I understood what it meant. I looked it up on the internet. Kafkaesque is the term most often used to describe an overweening bureaucracy or system that traps an unwitting individual in an illogical, nightmarish maze governed by forces beyond his or her control. And that's what we're looking at, ladies and gentlemen.
all right, and on that note, Eva Ludvig, thank you.
How can I add to that, Eric? I want to thank our moderator, Alicia, as well as our extremely informed and articulate speakers, Minister André Fortin, Jeff Chamy, Eric Maldoff, and Erin Durfel. I also want to thank all of you who joined us for this webinar. You have taken an important step in understanding this extremely complex bill, as you have heard, and worrisome bill. It proposes radical change of concern to our community and to all Quebecers, English-speaking or French-speaking. This bill represents a major shift in policy that will impact patient care and extinguish our voice in the running of the healthcare and social service institutions that our community has built and maintained for generations. We have taken note of the concerns you have expressed, both in the questions and the comments posted in the chat. We are taping this session, which will be available on the QCGN's YouTube channel shortly. We encourage you, as our panelists have done, we encourage all of you to speak out in whatever way you can against this proposed legislation. You can do so also by speaking with your MNA, sending comments to the Committee on Health and Social Services, going on the internet, for signing petitions, whatever you think you can do. We have shared the link for the Committee on Health and Social Services in order for you to allow to comment on the bill and as well as in the chat. Thank you all once again, our extremely articulate and very generous panelists, as well as our very, very professional moderator. And I wish you all a good evening. Thank you.